All right, so let's look very fast. Um, let's look at health planning. In this session, basically, we are going to know what health planning is, what are the steps of health planning, why do we need to do it, what are the different models and types of health planning, and what tools can you really use in planning. So that's what we are going to look at. So by definition, health planning is about identifying and addressing the health needs and priorities of a population or a community. Okay, so it involves us assessing the community. That is, uh, we can conduct studies or assessments basically to look at the health problems of a given community, and then we develop strategies or interventions to address these problems. So health planning basically involves identifying the health needs, setting objectives for the intervention that we want to do, uh, and then we see uh, how we can actually implement these programs, and then finally do monitoring and evaluation. Okay. It may not be that all the time we develop new plans. It can also be that we revise the existing plans. Okay. So if we having um, a mosquito distribution campaign, okay, so we have the plan for it where we first assessed and found out that many people don't have mosquito nets. So the intervention is to distribute these mosquito nets. So we have a plan for this distribution. So along the way, we can discover some things and then revisit the plan and revise it. So health planning may not necessarily mean that we always have to start from scratch, but it can also be that we are basically revising existing plans. So regardless of where you are and what position you hold in an organization, you always participate in health planning in one way or the other. You sit in those meetings, you sit in program reviews, you sit in donor meetings. Okay, so all these provide you an opportunity to refine your plans accordingly. So everyone, whether you are working in the hospital, whether you're working with an NGO, or you're working with the government, or you're working in a community-based organization, you always have situations where you sit down and review the existing plans for any given health problem, or you will have an opportunity to sit and devise and participate in the design of a particular public health intervention. So if we actually do health planning quite well, the following will happen. One is that you will know where to put your resources. Okay? You will know how to allocate your resources to get better health outcomes for the population. So that means that you actually avoid wasting of resources. You actually also make sure that the communities or the population actually get the interventions that address their immediate needs. Okay, if you don't plan well, you can address a problem that is not considered as a priority by the community. So you get issues there. So if you do health planning, which is participatory, it means that the chances of also the community embracing the public health intervention, those chances actually increase. Okay, but overall, you're putting resources where there is need, and therefore going to improve of outcomes and also reduce on of disparities. So what are the different models that you can use for planning? We are going to look at three: uh, top down, okay, the one we often call top bottom planning, and then we have what we call bottom up or bottom top planning, and then participatory health planning. When we talk about top down planning models, we are referring to the planning where you have those people in authority or the health experts deciding what is best to be done for a particular community. So they make their decisions and then they employ them. They implement these programs that they have decided on. Okay, so in this case, it means that they don't actually seek for the input from the communities. Okay, that is top down. The advantages are that actually it is very efficient. Okay, it is very efficient. That means that decisions are easily taken. You can easily make decisions, and what you do in population A will most likely be the same in population B. So that means there is consistency and there is a particular standard that you actually follow. And the challenge is that if you don't seek for the community's input, you will get resistance. Okay, you will get resistance. Therefore, you will not be able to implement the intervention as you wish to implement it. Okay, so you really need to make sure that you incorporate the input from the local communities such that their local needs and preferences are actually incorporated into the health programs. Okay, so those are what I've just explained. So the weaknesses that you would love to read local knowledge. The communities are actually aware of their local contextual situations. So when they provide you with this input, it means that they are actually giving you ways in which you can implement the program that you want to. But if you don't seek for their opinion, then they will feel disengaged. This therefore means that they will not own up. Okay, they will not own up. Sometimes they will not support the intervention. So those are the challenges with top down. And then bottom up, this is where the communities actually participate in health planning. This is to say that they are given an opportunity to air their demands and needs. Okay, the benefit is that of course it is responsive, flexible, and empowering. Often these communities actually understand what they go through. Okay, so they understand their needs, they understand their preferences, and therefore you are most likely going to design public health interventions that are responsive to their needs. Also, in a way, they're going to be flexible and empowering. The challenge is in coordinating these communities. Okay, often it can turn to be chaotic, fragmented, and inefficient. Okay, because you really have to listen to the community's inputs. Okay, and of course they can be differing views from the same community. So building up consensus can be quite difficult, but of course it is needed for the success. Okay, so when people participate, they own up the project, chances of sustainability are increased, and people basically support the project. They will support the project, and also the project, if you involve committee members, you have the opportunity to adjust the project according to the local needs. Okay, because we have contextual matters which are very vital program in programming or program design. Okay, the challenges are the ones that I've just talked about: inefficiency, time consuming, fragmented, coordination issues become problematic. Okay, and then we move to what you call participatory models. This is where you have active collaboration of all stakeholders, including health experts, authorities, beneficiaries, and other relevant actors. Okay, so this is what I can say is more preferred because it is inclusive, it is sustainable, it is also democratic. But these challenges are also similar to what we saw in bottom-up models. Okay, so we move to the different types of health planning. Dispersed health planning is one. So here we are giving the local levels of authority, or the local, or the people at the lower level to make their own plans. Okay, this often can be of, let us say, county health plan. Okay, because it is the people on the ground to make their plans. It could be a hospital health plan. It could be a health plan for the primary health care center. Okay, these are the people on ground who are actually making these plans. So that is dispersed planning. It's basically a decentralized approach to planning, where different entities make their own plans. And then we have focused health planning, where the planning is addressing a particular health problem, or the planning is focused on a particular population that is facing a particular health problem. Okay, so for example, you can have the national HIV programs, mental health initiatives for refugees. So you see that there are problems, health problems that we are basically planning for. That is health focused planning. And then central planning, this is now the planning at the top level, okay, usually by the National Ministry of Health or national agencies, and then regional or planning at the regional level. Okay, of course, these are often strategic in nature, strategic plans, or let us say the strategic plan for South Sudan 2020 to 2026. That is central planning. That is done at the top level of the government. So when you sit down to do health planning, you can come up with what you call health plans. You can come up with the program implementation documents, or you can come up with a policy, or you can come up with the ways in which resources can be allocated. Okay? Or you can come up with the performance measures and monitoring systems. This is basically to say that when you sit down for health planning sessions, you have different aims. Okay, the aim can be that you want to develop the hospital strategic plan for 2024, 2027, for 3 years. Okay, that is the plan that you want. So that becomes a deliverable for that health plan. And then you can also decide to say that we need to sit down and plan for the leave policy for the hospital. So what you have is a policy on leave for the health workers in the hospital. Okay, or you will sit down to say that we are going to receive money, we are going to receive a grant, but how are we going to use this grant? That is a resource allocation. learning session. So what you'll come up with is a resource allocation modalities that you have sat down and determined. And then also you can sit down to say, we want to evaluate, we need to come up with a plan that will tell us how we are performing. So you can come up with issues to do with the number of hospital acquired infections, the number of average number of days patients stay in the hospital. So all these are indicators that will indicate your overall performance in the health facility. So health planning can also deliver such documents that you can basically use. So what are the steps of health planning? You need to first assess the situation. This is to say that you conduct a situational analysis. So we look at, if depending, this has to be very specific, depending on why you're actually sitting down for to plan for health. Are you sitting down to see what health problem you to address, okay, and how you're going to address it? If that is the situation, that means that you need to conduct data comprehensive health assessment of a given community, such that you know the health problems in that community, then now come up with the interventions to address the most pressing need. So that means that situation analysis needs you to carry out surveys. You can use questionnaires, you can use checklists, you can use what you call desktop reviews, you can call for community meetings. Okay, those are all sources of data that you can use to address, to identify the problem, and then also get feedback on how this problem can be addressed. So you conduct situation analysis. And then we go to the intervention that you already have in mind, the intervention that you want to really implement. Then you set the objectives, the goals and objectives for this intervention. The key thing is that the objectives should meet what you call a SMART criteria, okay, which we have discussed several times. And then now look at the different ways in which this problem can be solved, the different approaches, and then select the most effective salvation, and then create an action, which we can say is what we call an implementation plan. Okay, what are you going to really do in order to see that there is change? And then for you to note that there is change, you carry out monitoring and evaluation. So that is the last step. There should be monitoring and evaluation. How are we going to collect data? What type of data? What tools are you going to use? What is your budget? So you need to have an M and E plan for what you're going to do. So if you come up with, for example, a plan that you have written that you are going to use to address the health problem, now time turns to action, time for action. What do you need to have in order? Make sure that the plan that you have on paper is actually implemented. You need the number of skills, because one, you need to know that you're going to work with different people. You need to have proper communication skills. You're going to communicate with the staff who are going to implement these projects or programs. Then you're going to work with stakeholders, key stakeholders. You need to make sure that you have the resources. You need to have very good skills in resource mobilization. Some of the people will need to be trained, so capacity building becomes very important. And then you also start to think about sustainability. Looking at the long-term impact of the project, the program. Often, planning is not an easy task. It requires a lot of time, a lot of resources. There are different people with different interests, so you really need to play the politics in the right way. So you have a number of challenges. Sometimes you don't have adequate data. Sometimes you have inexperienced staff. You don't have all these resources that are actually very important in planning. So you have these issues. Okay, you have unstable, the fragility of the health system. Basically, it makes it very difficult for you to plan. Okay, but whatever the situation is, you need to make sure that you do the right kind of planning. Make sure that you establish collaborations with partners. Make sure that you leverage the technology to improve issues to do with data analysis, collection, decision making, and then also um, look at the look at prevention being better than cure. Okay, this would be very good in resource utilization. Okay, um, and then let's look a little bit on strategic planning, and we will actually look at the strategic planning in public health tomorrow. Okay, but here let's basically have it's a bit of what strategic planning is. With the strategic planning, it's basically setting organizational goals, determining the right actions to take in order to achieve those goals. Okay, so you basically plan the organization usually in a long-term or mid-term time frame. Okay, you plan in terms of 3 years or 5 years or even 10 years. That is about strategic plan. So you look at you carry out an assessment, determine the standing of the organization in terms of its weaknesses, strength, threats, and opportunities, and then look at the possible strategic directions that the organization can take, then choose the most appropriate one, then implement and then evaluate it. So that is strategic planning. So we shall look at what it is. So in terms of the steps, they don't really differ so much from the health planning, but that we looked at the stages or the steps that we looked at earlier on. Conduct an analysis of the environment, set objectives, formulate the strategy, implement, and then evaluate. Those are the steps. Okay. In terms of assessment, you can use the SWOT analysis to really help you to assess the situation. You have what you call affinity diagrams, where you group and organize ideas to identify patterns and relations. This is basically very good together with mind mapping when you brainstorm, basically ideas coming in here, right, center, right, left, and center. So when you put these ideas together, you can really get to visualize what is happening and then come up with ideas to solve problems that confront the organization. The mission statement is very important in directing the organization's purpose, directing the strategy. Okay, for everything that the organization does should be in line with the mission statement. And then we have what you call the balanced scorecard. This is also an assessment tool. You want to assess the organizational performance using financial and non-financial indicators. We shall also look at this in our lecture tomorrow. So you will also come up with the what you call operational planning. Uh, operational plan is basically how the activities would be done on a day-to-day basis in order to achieve the strategic goals. Okay? What is done today will influence what can be achieved in the next 3 or 5 years. So, um, what needs to be done on a day-to-day basis is very important. So, if you plan for that, then we say that what you're doing is what you call operational planning. Okay, so it is very important because it increases efficiency, resource allocation, and coordination of activities. You can use a number of tools for this planning. We have what you call the program logic model, which is a graphical representation of the inputs, outputs, activities, and outcomes of a given health program. This is, this is basically looked at in detail in the M&E module, which we have actually covered. And then activity hierarchy. This is where you break down activities such that it becomes very easy for you to manage and monitor. So that marks the end of this session on health planning. If you have any